Well, good afternoon, everyone, and thank you for being here. In light of the latest data on the spread of COVID-19, we are announcing new restrictions on business activity in the city of Philadelphia. In addition, non-essential city government operations will be halted for at least 2 weeks. Managing Director Brian Abernathy will give details on all of this shortly. These changes will disrupt life in Philadelphia, and we do not make these changes lightly. We are well aware of the potentially devastating effect they will have on the businesses and workers in our city. Our administration is actively developing grant and loan programs aimed at business and job preservation. Our Acting Commerce Director, Sylvia Howard, will speak about that shortly. For now, I urge all businesses and residents to observe these restrictions so that the threat of this virus can quickly be eliminated. And before I turn it over to Dr. Farley for more of the details, I want to say to everyone, let's be calm, but be sensible. Look out for each other. Look out for your elderly neighbors. Although you're not supposed to have physical contact, you could perhaps order groceries if necessary or do things to help us all out. Our children that need to be fed are being fed, and we are doing everything we can do to flatten that curve so that we can get back to normal. And it might be a while, but we'll go on from here. So I want to bring up Dr. Farley first. He will update you on the latest cases.
Take a square here first. So welcome and thank you for coming today. First, I want to update you on the latest case counts information we have for Philadelphia and the region. As of 7:30 this morning, the state of Pennsylvania was reporting a total of 63 cumulative cases of coronavirus infection in the state, of which in the Philadelphia region there were 24 in Montgomery County, 7 in Delaware County, and 4 in Bucks County. In Philadelphia, since the last time we spoke yesterday at 1 p.m., we have 1 new case that's been reported, which brings us to a total of 9 cases in Philadelphia. The 1 new case is a male who is in his 20s and had international travel to an area that was heavily affected. The health department is now identified 104 contacts of people who were known cases. They're either being monitored at home or in the process of reaching them to do that. Then an update on the availability and our recommendations around testing for this virus. In the last 24 hours, we have received 88 test results, so that is a large increase from the number of test results we've received in the past. All of those are negative except for the 1 positive that I mentioned a minute ago. The national laboratories, LabCorp and Quest, have greatly increased their testing capacity and their throughput. And so I made a recommendation yesterday, and I want to emphasize it even more today. We want doctors to test more people. If most of those people are negative, that is fine. We need to test more people who don't have this infection so that we can identify the few people who have this infection who are missing right now. So now when I say test more people, I'm talking about testing people who have symptoms. They should not be testing people who are perfectly healthy. But the symptoms can be quite variable, and if a doctor has any suspicion at all, we recommend that doctor test for this infection. The public needs to understand that as part of that, if we are testing more people, that just because someone is tested does not mean they have the infection. We're hearing many people who are worried about someone having been tested, and the vast majority of people, probably well over 95% of the people who are tested, will be negative. Now, as far as the availability of sites to collect the sample, there are several healthcare providers in the city who are setting up rapid and drive-through testing sites. We will give you more information about that in the future, but it's increasingly available to physicians around the city. And the city is working for several options about similar rapid and drive-through testing sites. And as far as new guidance and recommendations, you probably heard that as of last night, the Centers for Disease Control recommended canceling all public gatherings and all meetings with 50 or more people. We had previously strongly recommended canceling gatherings of 250 or more, and considering canceling gatherings of less than 250, we are going to be consistent with the CDC guidelines today and recommend that people cancel gatherings of more than 50 people. If people feel that they have to hold meetings of less than that, there are a series of risk reduction steps which we included in our recommendations around the 250 meeting rule, which we will be recirculating. And they involve excluding people who are ill, excluding people who are vulnerable, having distance between people, and using hand sanitizer, as we did here. I want to remind the public that if people have questions about this, we have a 24/7 hotline that they can call to get those questions answered, 1-800-722-7112. That's 1-800-722-7112. And then reminder what everyone can do to stay safe. Stay away from other people, particularly wash your hands before you touch people, after you touch people. Don't shake hands, don't hug. If you are sick with a fever or dry cough, stay away from people. Contact your physician about getting a test. Let me say, this is a rough patch for everybody here, where there's going to be a period of time when many of us are going to be at home in our homes or apartments, away physically from other people. But there are still, thankfully, plenty of opportunities for people to stay in touch with others and to help others. And I think that's what we ought to be redirecting our energies to. So use this opportunity to call your relatives, including that relative you may have had an argument with and haven't been on speaking terms for a while. Call your friends, call your neighbors, see how everyone's doing. Connect by Skype, do Google Hangouts. There's an awful lot we can do electronically these days without a physical connection to help people out, and this is the time to do it. Thank you very much. Now I'm going to turn it over to Managing Director Brian Abernathy.
Thank you, Dr. Farley. The following changes on commercial activity are effective today, Monday, March 16th at 5 p.m., and will last through at least March 27th. Only essential commercial establishments should remain open. To allow for essential goods to be accessible to the public, the City of Philadelphia designates the following businesses as essential: supermarkets and grocery stores, big box stores, pharmacies, discount stores, mini markets and non-specialized food stores, daycare centers, hardware stores, gas stations, banks, post offices, laundromats and dry cleaners, veterinary clinics for domestic pets, and pet stores. Also deemed essential are commercial establishments that sell any of the following: frozen food products, non-specialized stores of computers, telecommunications equipment, audio and video consumer electronics, household appliances, IT and telecommunication equipment, hardware, paint and flat glass, electrical plumbing and heating material, automotive fuel, domestic fuel, sanitary equipment, personal hygiene products and medication not requiring medical prescription, medical and orthopedic equipment, optics and photography equipment, and soaps and detergents. Food establishments, meaning restaurants and bars, may only accommodate online and phone orders for delivery and pickup and cannot allow dine-in service for the duration of these restrictions. As the mayor said, today we are halting all non-essential city government operations in order to reduce the spread of the COVID-19 virus in Philadelphia. This means that all city government buildings will be closed to the public effective tomorrow, Tuesday, March 17th. Staff members are still expected to report to work on Tuesday, March 17th, unless otherwise instructed by their supervisor. Individual department heads are currently determining what operations are essential, and city workers should consult with their supervisors on their status. Essential operations will include public safety, health and human services, utilities, sanitation, and finance and payroll. I want to thank all of our dedicated city staff for their support during this time, and want to also specifically mention the folks who came together in a very short period of time to make sure that our children were fed today. We were able to distribute over 2,000 meals, and that was done because of partnerships with our city departments and our outside stakeholders. And I'm proud of the safety net that we've been able to put in place for the workers who are going to be impacted by these commercial activity restrictions. And with that, I'm going to turn it over to our Acting Director of Commerce, Sylvia Galley Howard, to say a few words.
Thank you, Brian. Good afternoon. I'm Sylvia Galley Howard, Acting Director of Commerce for the City of Philadelphia. As my colleagues have said, we recognize businesses in Philadelphia and around the country are especially impacted by the spread of COVID-19 in Philadelphia. We also know that our small businesses, which are the backbone of the city's economy, are particularly vulnerable. Today, I want to share that the city, along with our partners at PIDC, will launch a program to support Philadelphia businesses, help maintain payroll obligations, and preserve jobs impacted by the spread of COVID-19. The program, which is still being developed, will be a tiered program that aims to provide targeted supports for small businesses. The program will include a mix of new grants and zero-interest loans for Philadelphia businesses that make under $5 million in annual revenue. In addition, PIDC will continue to offer its existing lending programs for small and mid-sized businesses on flexible terms to provide working capital, fund contract receivables, refinance high-interest debt, and meet other needs. We recognize the critical need to support businesses and workers during this unprecedented time. This new program will provide needed support to our city's businesses, help them reopen once the COVID-19 closures cease, and retain or rehire employees as they recover. More details about the program, including how businesses can apply, will be announced in the coming days. I also want to reiterate that we are still exploring additional relief options available to businesses of all sizes that are being made available through the state and federal governments as well as other sources. Right now, we are circulating a short online survey to gather more feedback from the business community. It has been posted to our website, phila.gov/commerce, and on our social media accounts at PHL Commerce. And I encourage everyone to send that around and have businesses fill that out. If businesses have questions during this difficult time, the Commerce Department's Office of Business Services is available to answer them. They can be reached through the Business Services Hotline, 215-683-2100, and email business@phila.gov. And again, that will continue even as we have closures, so please do not hesitate to reach out. Thank you.
At this point, Council President Clark wanted to provide an update on City Council operations.
Thank you, Brian. Good afternoon. Just basically, I want to thank the mayor and his team for being proactive to this approach. The simple reality is anything that we can do to minimize any spread of this very, very aggressive virus is clearly something that we need to do. Last week, we talked about the suspension of council sessions and public hearings. For this particular week, we will extend that for an additional week. It will overlap into the budget hearing process. We believe that we will be in a position to have discussions by remote fashion. There is one thing in particular that we are in the process of establishing. There is an ordinance, a transfer ordinance for emergency authorization to make sure that the managing director's office has the appropriate revenue to do what it needs to do to fight this virus. We will be in a position to do that remotely, allowing some levels of access from the public as required by certain statutes. So we're going to do whatever we need to do. We're asking people to follow the signs, follow the recommendations of the city. The city's website is real clear in terms of what you should not do. Working together, continuing to be in a unified front, continuing to have the messaging that's coming out here today. We will figure out we will get through this. Just want to thank my colleagues who are here today to continue to support. So, Mayor, your team, guys, thank you so much for taking the leadership and moving this forward. Thank you.
Thank you, sir, and thank you again for your partnership throughout this crisis. The President Judge, I.D. Fox, also wanted to provide an update on the court's operations.
Thank you, and thank you, Mr. Mayor, for inviting us here today as another branch of government. I am President Judge and Chair of the Administrative Governing Board for the 1st Judicial District. In response to this crisis, I filed a petition with the State Supreme Court requesting that they provide me with authorization to declare a judicial emergency under the Rule of Judicial Administration 1925B. Right before coming down here today, I did receive an order from the Supreme Court granting that emergency power. I will enter an order shortly. As such, the 1st Judicial District and the courts and related offices, with the exception of certain services that we deem essential, will be closed from tomorrow until April 1st unless otherwise ordered by the court. Jury and non-jury, both criminal and civil, as well as preliminary hearings are suspended and will be rescheduled at a later date. Jurors do not need to report for jury duty. All civil pretrial conferences, case management conferences, diversion programs, discovery lists, and trials are canceled or postponed. All criminal trials, pretrial conferences, diversion programs are also canceled pending further order of the court. Prior to this date, we had postponed all sheriff sales in the month of March. We've also suspended the issuance and the enforcement of writs of possession to avoid evictions. We have previously canceled our Thursday mortgage conciliation program as well as our tax programs. The following essential court services will remain available. Preliminary arraignments and emergency protection from abuse orders will continue on a 24/7 basis. Non-emergency protection from abuse petitions secured at family court will resume upon the reopening of our courts. Juvenile detention hearings and shelter hearings will continue as required under the law. An emergency judge will be available from 9 a.m. to 5 p.m. for civil emergency filings. Those must be filed in the Stout Center in person. We operate in an e-filing system, but we are requiring emergency civil motions to be filed over the counter in person at the Stout Center. Those emergencies will be limited to health and medical emergencies, public safety, and emergency guardianship appointments. During non-business hours, the court will continue to, as we always have, to have a designated emergency judge available for the City Hall operator. All pretrial services in adult probation and parole department client interviews will be suspended for the next 2 weeks. Gagnon 1 hearings and EMU supervision will continue. Municipal court will continue to hear video bench warrant hearings for individuals incarcerated in the Philadelphia prison system. In addition, early bail review will continue. Traffic Division will remain open to retrieve impounded vehicles 3 days per week and will update the public through press releases as to what days. We will be contacting parties who are scheduled to appear to court during this period to inform them of any rescheduling changes. We will continue to reevaluate all closures moving forward and will alert the public to any change. Again, thank you. We thank our partners in government for their cooperation and assistance. Thank you.
Thank you, Judge. And before I take questions, I do just want to say thank you again to all of our partners in this. To watch the city come together in this crisis has been something that's been truly amazing to watch. The amount of work that has happened at our Emergency Operations Center, the hours that our staff has put in, both leadership and frontline staff, we have been able to prepare ourselves for both the public health crisis, but also to make sure that our vulnerable citizens are protected, to make sure that those who may not be with a job are fed and provided assistance, and that our core functions, whether that's through the court or through the legislative process, are being maintained to the best of our ability as we, again, try to stop the spread of this illness. It is going to take all of us to continue that work. This is not going to end overnight. And it's something that we will continue to work together as partners, both private sector and public sector, nonprofit and for-profit, in order to bring Philadelphia both through the crisis and then figuring out how to rebuild afterwards. And for that, I thank them. And we're happy to take your questions.
Do these have the closure of non-essential businesses, the authority of law, and what we can do if someone decides they're simply not going to close, as you know about?
And the question is do these closures have law behind it, and what will we do to enforce? Yes, they do. The mayor has broad authority over these closures, and we'll have both health and L&I inspectors prepared to enforce should businesses open. Sure.
I want to just get one phone number in here. If residents see a restaurant or a bar where people are dining inside after this rule goes into effect, they can call the health department and we will send an inspector out to enforce the rule. The number is 215-685-7495. That's 215-685-7495. If you see a restaurant that is open and people are dining inside, we'll send an inspector out. It's the same line we have when people have a complaint about a restaurant under ordinary circumstances.
Dr. Farley.
I can't imagine. The question was, will we arrest someone who kept their business open? I can't imagine we're getting to that point. Again, I think between our health inspectors and our L&I inspectors, we will be able to manage through this fairly well. Ma'am?
Yeah.
Many of the restaurateurs that I've talked to personally are in favor of this. We're thinking about doing it themselves, and we gave them some motivation to do it, and they've expressed that they're happy with that. So I'm sure there'll still be some people who may violate it, and we have a number, and we'll go out and enforce.
I just have a question for Dr. Farley. It's in terms of social distancing. It's a hot word that we're
Right.
hearing right now. What exactly are some do's and don'ts of social distancing, and how can people best practice them?
Yeah, so the rules we put in our meeting policy are, try to stay at least an arm's length away from people, up to 6 feet, okay? If you're sick, you should not be in a gathering. Wash your hands frequently or use hand sanitizers frequently. And those are the key additional guidelines there.
And I'm getting a lot of tweets from people concerned about SEPTA.
Right now, SEPTA is operating normally. We've been a reduction in ridership just anecdotally, and it is a major lifeline for people to get to work. So we'll have to make that decision as we. This is a situation that has no playbook. It's hour by hour. Things change in an hour that were totally different just 60 minutes before. So we will continue to monitor that and see what we have to do to adjust. But that is a major way for people to get to work.
And I would actually like to add on SEPTA, it's also a significant transportation source to get to healthcare, to get to anything. And I think for SEPTA to shut down would have a significant impact on our ability to provide healthcare going forward. So the question is, will trash be picked up, and will rec centers still be open for kids to get food? Yes, trash will continue to be picked up. Sanitation is considered an essential service. And yes, our recreation centers, those that have been designated, will continue to be open not just for food for children, but may also provide food for adults and the community as well. The question is, how will we know it's safe to reopen businesses?
So we're going to be monitoring the outbreak, the number of cases that come per day. You'll be able to see that as well. When we start to see the number go down, that's a sign that things are moving in the right direction. These are social distancing approaches. At the same time, we're going to be doing our case containment approaches. We interview cases, we interview the contacts. We think that is a long-term going to be the way to continue to solve this problem. Even if we have cases in the future, in the future, we may be able to continue that and not require the social distancing to stay ahead of this. So I can't say when, but I can say that if you follow that case count, that'll be the best indication.
You said on Thursday or Friday that your case count was difficult because there was a lag in testing cases at the time. Is your testing, is Philadelphia able to test properly so that you can measure how many cases are happening?
Yeah. We know we need to test more people, but the testing capacity is improving every day. As you saw, 88 tests today. I think over the weekend we were at 15, 20 tests a day. So as the number of tests increases, we'll have increasing confidence that we're not missing cases. Right now, we don't know for sure.
Dr. Martin, have you been able to model, the New York Times reported last week on some modeling that the CDC had done that it actually listed potential death rates and how many people would be sick, how many would go to the hospital. Have you been able to do that in a city with a population of 1.5 million people that happen to be quite poor?
No, I've done some very rough informal calculations myself. Those models are based upon worst-case scenario. If this virus is released throughout the community and that the majority of people who come in contact with it get infected, I don't think we're going to hit the worst-case scenario. The actions we're taking today are to prevent us from hitting that worst-case scenario. So I would not look at those models as predicting the future so much as just something internal for planning.
What are your rough numbers? What is your rough numbers to show you?
I can't give you that here now. Again, I am optimistic that we can contain this with the actions we have today.
Nina?
For a worker who gets laid off tomorrow, who might not be in that, who might not fall under the businesses that made $5 million or less category, or their business owner might not know they're eligible for the grants or loans quite yet, what should that worker do? Is it just unemployment benefits? Is the rainy day fund going to be made available in some capacity? What should workers do if they're laid off tomorrow?
So the worker should absolutely file for unemployment. I believe the governor made an announcement on unemployment today, and we're continuing to work with the state to streamline unemployment benefits, SNAP benefits, and TANF, and we'll continue to advocate on behalf of those workers at both the state and federal levels to make sure that this crisis isn't just about those who may be infected by COVID-19. It's also about those folks who may lose their jobs as a result of us taking action to contain the infection. Certainly, we've increased our social safety net around food access, and we are exploring other options, whether that's around individual assistance or additional housing support. As you heard Judge Fox mention, evictions will be suspended. We're continuing to work with all of our partners in order to be able to make sure that our workers are protected going forward.
And then just one more thing on that. I've had some initial discussions with our restaurant industry. They are interested in trying to get together to see what they can do to pool some money or to find some resources to keep their people paid as long as possible.
Yeah, so we know that if this virus were to spread unchecked, that we would overwhelm our healthcare system. The healthcare hospital systems have been planning for that a long time. So one of the key reasons why we're doing the steps today is to try to prevent that from happening. I can tell you that the hospitals have discontinued elective surgeries and other elective procedures and other elective admissions. So currently, the hospitals have more empty beds than they do at any other time, okay, so that they are making capacity available. And there are additional steps that they can take, even to go beyond their typically licensed capacity if need be. So we're working very much on that. We hope we never get to the point of exceeding our capacity. For the moment, we feel comfortable, but it's something that we need to take very, very seriously to prevent us having that point.
General. So we are working on adding additional shelter capacity for those individuals who are currently identified as homeless, as well as a quarantine space for those who may suspect that they have been infected with the virus. That work is ongoing. It hasn't been complete, but it is a top priority to have resolved this week. Again, this is one of our top priorities for this week is to make sure that we have food distribution, housing, and quarantine space for those individuals who are experiencing homelessness. Again, there's a lot happening. We've been able to stand up a lot of services in a very, very short period of time. I'm confident in our team to be able to do that, but I can't do everything overnight. Channel 3 and back. So I can't say why the governor didn't include Philadelphia in his order last night, but I can say that the city has been looking at this for a significant period of time. And again, Philadelphia is the poorest big city in the country. We have significant needs. We wanted to make sure that safety nets were in place for our workers and for those who are suffering poverty. At this point, I feel comfortable that those safety nets are in place or will be in place very shortly. But again, we also need to continue to monitor what the city's posture is every day, hour by hour, day by day, and we will continue to make changes and adjustments as we need to. The question is about changes to the police department and officers on patrol. We always evaluate our deployment strategies around the police department. At this point, there's no deployment strategies or changes to announce. The question was about the officer's funeral for Friday. We are given the CDC's advice last night, we're in ongoing conversations with the officer's family, the FOP, and the police department on what our next steps are. Laura? The question is what is our coordination with the governor's office, and if there's a larger statewide closure that is expected. Our chief of staff speaks with the governor's chief of staff on a regular basis. The mayor speaks with the governor on a regular basis, as early as this morning, or as late as this morning. So they know what our posture is on a continuous basis, and we know what their posture is. We're looking forward to working with Harrisburg as partners. I have no knowledge of a statewide shutdown. I don't think the city has one, so that I would refer back to Harrisburg. Pat? Will ACCT, which is Animal Care and Control Team, stay up and running as the only intake shelter? It will have some operations. Has not been determined exactly what those operations will be yet.
Mayor, where do you think the leadership of this country is coming from in response to the coronavirus? Is it state and local? Or do you think the president's missed here?
Well, I don't think this is an appropriate time to get into presidential politics and the president. They're trying their best, I think, at this point now to get the test kits out, and if they can do that, that'd be great. But I do think that states and cities are based on their various circumstances, are leading the way. We don't want to dismiss the federal government, because at some point in time there's going to be a huge need to help financially with recovery. Same thing with the state legislature and the governor's office. So we want to maintain good relationships with everyone at this point, so we can utilize all the opportunities to move forward when this is over. Epidemiological, yes. As long as it takes. I mean, again, there's no playbook with this situation, and hopefully what we'll see because of these measures is a flattening of the curve and a kind of calming down of the situation, and we'll go as long as we can. I mean, we're committed to taking care of our citizens and to trying to keep our businesses be able to rebound when this is over, and that's what we're here for. And we're going to need help, certainly from the state and federal government, to do that. Medically speaking, I am not a doctor, and even though I think the doctor here doesn't exactly know.
Yeah. I don't think anyone knows. We've announced this policy effective for 2 weeks, am I right? 14 days. And then we'll evaluate that as the epidemiology unfolds. Yes.
Can you talk about what close monitoring of them means? Are they in isolation at home? Are they being tested? Is their temperature being taken? Are their contacts being contacted? What is that?
They're at isolation at home. We're in contact with them every day to instruct them to look for symptoms. If they have any symptoms at all, especially fever, but other symptoms as well, then we make sure that they're tested. There's no reason to test them if they don't have symptoms, and so we don't do that. We wait to see if they develop symptoms. But we do have that daily contact. As I said earlier, this is a time to get together virtually with your friends, family, and neighbor. There's a lot of opportunities electronically these days to be in touch with people, even if you're not touching people. And people should take that opportunity to do that. You know, human relationships are important to health over the long term, and even over the short term. We can still have those relationships without having to physically be in the same spot. Now's the time to take advantage of that. I don't have any details to say other than that we are working very actively with partners locally, partners at the federal government, to try to have one or more large-scale rapid testing sites available. And so we're optimistic about that, but we don't have anything to announce on that yet.
Question for Dr. Farley or Dr. Abernathy. What recommendations can you, or is it Mr. Abernathy?
Mr. I appreciate the program.
No problem. What recommendations can you make for best precautionary practices for those living with HIV who are not suppressed or other chronic illnesses to ward off this virus?
If people have HIV infection and they're not immunosuppressed, immune systems are in pretty good shape, and so they're no more risk than anybody else. Everybody should take precautions, but the same precautions as anyone else. Keep a distance, wash your hands, and if you are sick, stay away from other people, get tested.
Okay. Great, thank you all.
Thank you all.
Have a good afternoon.